welcome back to another episode of the Diamond Hands podcast. Today, we are so excited to have Dr. Itay Wiser, a plastic surgeon from New York City. Welcome.
Hello.
So happy to have you on the show, guys. I stalked him for like half a year for this.
Wow. Happy to be here.
Same. So, this is like a really fresh perspective today because, a lot of the, guests that I've had there have been med spa owners. So they've been nurse practitioners, nurses, and things like that. And so for season 2, I was like, oh my goodness. I was like, medical aesthetics is really broad. So I was like, let me get into the plastic surgery side. So I really loved your page and, and we're going to get into some of the things that I liked about you. You're a musician and things like that. So I was like, oh my God. I was like, he's so cool. And I wanted to get to know you. So here we go. So tell us, Dr. Itay, a little bit about your background and what led you to your path of being Dr. Itay Wiser, because I know you have a couple of degrees. Guys, he has a lot.
Well, I'm an Israeli guy, born and raised in Israel. At the age of 18, every Israeli guy needs to go to serve the army. And I had the privilege to go on a medical military program. So I started med school at the age of 18 at Sackler School of Medicine, Tel Aviv. And then after that, after you complete the service, you're supposed to go and serve the military as a military doctor. And then I fell in love with research for some particular reason I don't understand until today. And I have managed to persuade my commanders to give me 3 more years to do a PhD. And I did a PhD in a very obscure field in medicine called epidemiology that no one knew what it is. Now, after COVID, everybody is an epidemiologist.
Everyone's like, oh my God, yeah. Everybody
talks numbers and he understands R0 and risk factors and everything and vaccines.
Yeah,
I did my PhD. I did my PhD on vaccines, actually on a vaccine for a disease that does not exist anymore, smallpox. Actually, the only disease eradicated by humans.
Wow.
In history. Yeah. So that was fascinating time. And I'm so happy I did it because then I understood that I could probably be a much better clinician treating people than, rats and pipettes and statistical softwares.
Oh, wow.
Then I joined the Army, served for 6 years in the infantry and special forces as a military doctor. And then I had to pick a residency. My initial thought was to be an OBGYN.
Oh, really?
Yes.
What was that your initial, why? You were studying animals and then OBGYN.
The reason is it's a fascinating field. It's very rich and complex. It's an optimistic field most of the time. Most of the time, yeah. Most of the time. And I love the combination of treating patients who are mostly women, which is my favorite population. And for sure. And having an optimistic field and it's very intelligent, very bright, always evolving. But then I stumbled upon plastic surgery, which is actually the complete opposite of epidemiology, the field I've done before, which is, everything's population, big numbers, and very scientific. Plastic surgery is on the outskirts of medicine. It's half art, half there's business into it, which is sometimes blasphemy for other doctors, involving, business terms. And it's very, very personal and very subjective. It's actually, I thought about it many years. How can you actually measure results in plastic surgery? It's good for the other, bad for another. They never agree. The most common sentence you'll hear from plastic surgeons are many ways to skin a cat and all kinds of those things.
Wow.
Yes. But I fell in love with this field because of mostly its very personal approach and touch to the patient, and mainly because it grasps a lot of It treats solely the quality of life of patients. This is what this field addresses. And it gives you a little bit of artistic freedom in what you do. And you sleep at night.
Interesting.
Not like OBGYNs. So, or less. So that's why I chose it.
Yeah, or less, exactly. Like that, and I think that's really cool that you were able to kind of, because like, you know, epidemiology is, like you said, that's like the study of disease. That's a completely different thing. It might have had its place if you wanted to do research for, I guess, OBGYN, I don't know, but it's just like you kind of found a way to kind of, because, you know, being an OBGYN, you're dealing with a creative force because the ovaries, the uterus, all that, it's a creative energy. And even in plastic surgery, that same thread is there. It's a very creative thing you're doing. But so it might not be OBGYN dealing with the uterus and on all these other things, but you're dealing with changing someone's face or their breast or whatever you're changing, which is, so I love that creativity and how you kind of continue to drive that.
I love it too. And every day I have the opportunity to be creative with my patients. And it's not necessarily by holding a knife. You know, when you sit and speak with your patients, the creative process starts. Because you're getting an input from the patient and you start to understand their concerns, their goals, and you dig in to see what really bothers them. And then you actually become a consultant. And you educate them about their opportunities and their possibilities, and you look at the short term and you look at the long term, and you set expectations, which is one of the major things that we do in plastic surgery. Because people come with unrealistic expectations many times to see you.
Wow.
And it's a process that eventually makes the people feel better about themselves so they can focus on the important things in life.
Yeah.
That's my motto.
Wow. And I think that's a beautiful thing, you know, that the consulting process is where you start creating, and that's where the art starts, you know, because with the internet, with Instagram and with all these things that we see today, I think sometimes, you know, when you talk about managing expectations, you know, patients come through the door and they're just like, oh, I want to look like this. And they show you their phone, or, you know, I'm sure that happens to you. And you're setting those expectations, and then that consultation is really where the work starts. And any provider that's not doing a consultation, it's like, what are you doing?
How can you treat someone without consulting them first?
Yeah. Yeah. So I've heard things, but you know, so what school did you go to for plastic surgery?
I completed my residency in plastic surgery in a hospital in Israel, close to Tel Aviv. I have trained there for 5 years. And then I was lucky enough to be accepted to a microsurgery fellowship. Microsurgery is a field in plastic surgery where we reconstruct the body or the wounds or whatever are the missing organs by taking from other places in the body. For example, after a mastectomy, breast surgery for cancer, I create a new breast by taking tissue from the belly with the blood supply. And then I need to connect the blood vessels, which are like 2-3 millimeter diameter, into blood vessels in the chest. So I do it under the microscope, and this is why it's called microsurgery.
Oh my goodness. So you're actually, so it's under a microscope. Are you using any like robotic things when you're doing that as well?
Not robotics, but you know, we bring the microscope, we drape it sterilely, and we sit together, two people under the microscope with small instruments and sutures that are like hair thin. And we suture vessels. Right.
Oh my God.
Yeah. And once we take the clamp off, you see we call it a flap, what we can disconnect and reconnect in a different place. So the flap comes alive again and you see blood flowing through it. Yeah. It's like a rebirth.
Oh my goodness. It's like I'm a very visual person. So like right now I'm like seeing that in my head, like something that's like, just like maybe white, doesn't have any blood in it, not much color, and like the color coming back into it. That's an amazing thing. Wow.
It is.
And so from there, after that fellowship, at what point did you say, hey, I want to start my own plastic surgery business? Because I know you were teaching as well on top of everything else that you do, but you were teaching as well. But at what point were you like, okay, I'm going to start my own plastic surgery business?
Right. So when I was training in Israel, my attendings, my seniors, always worked in a kind of a model that was hybrid, and it fit the health model in Israel, which is they had part-time work in the hospital doing public service, in the public hospital, public system, and they had part-time in the private work. And in that sense, this hybrid kind of model allows them, first of all, to do reconstructive work. Hospitals are more on the cutting edge and involving developing health. They have challenging cases that they can learn from and evolve. And on the private side, they can translate this experience and knowledge to give better care and optimize care for their aesthetic patients.
Yeah.
And it goes hand with hand. And I try to implement it here. It's less common. I found it less common, especially in New York City. So when residents and fellows complete their training here, they either go to completely private or they go to the academic / public. So because they want to be focused, and I am trying still the hybrid model. I think it contributes to my overall professionalism, but time will tell.
Yeah, I guess so. And so, so you said, so you talk about focus, and I know that since you're a creative person, you have a couple different, irons in the fire, if you will, or whatever. And then something that I did notice about you, and something that I love that you do share with your audience, is that I believe that you're an accomplished musician. Like you play piano very well. Whenever I heard that Bach, and I was like, yes. So, tell me about, for yourself, and if you guys don't listen to classical music, I know I'm dorking out here, but tell me, like, who is your favorite composer that you studied, and why?
I have many favorite composers. I'm a big fan of the classics. I was educated and trained on classical piano.
Yeah.
And the most challenging and composer that I really adore and admire is Johann Sebastian Bach, who's from the Rococo period, lived in the 17th century. He's a very famous composer. And what I really like about his composition is the polyphony and the way that it's called counterpoint or counterpoint.
Yes.
And you can hear three tunes going at once and intersecting and intertwining and talking with each other. And it's just amazing. It's mind-blowing. When I hear it, it's just the ultimate beauty. And it actually connects to beauty in a sense, in the mathematical sense and in the harmonic sense.
Yes.
It's just pure beauty for me. And sometimes I like to hear it in the OR when I'm operating, and I just feel, the harmony comes from one side into when I'm planning, the proportions and the symmetry. I have no words to describe it. It's orgasmic.
Well, it is, guys. And you want it to be an OBGYN, so you know the mathematics of that too. But it's just like, it's like, so one of my favorites of Bach, I love the Passacaglia. I'm probably not pronouncing it right. I read too much, but in D, and it's an organ piece. And because I love the pipe organ, I played in church and everything back in the days. But it's just like, when you hear like you were talking about the polyphony, it's like it's all going. Like if you listen to like the bass line, I'm obsessed with the bass line. You just listen to that, and it's like, and it's like you just hear that theme coming over and over and over again. And it's like when I was younger, I was homeschooled for high school, weirdo. But it's like I would love to go to the concerts at Yale, Moosley Hall, and I would sit there in the pipe organ concerts and just like, oh, they had lunchtime pipe organ concerts, and I would just like sit there and like listen. And it was like the most. So I share that with you, like the music, and it's not found in music of today at all. Music of today is very shallow. But whatever.
It is. I think it's I like the music of today as well. I think it goes to other aspects, and it's more suitable to the way we live today, which is hectic and hits and bits and of information. We have less patience to listen to stuff. Mm-hmm. And I understand, my kids, they have no patience to listen to classical music at all. And I understand them because they live in an ADHD society today.
Yeah.
And it's an acquired taste. It's an acquired taste. I remember myself as a kid, I didn't have a lot of patience to sit and listen. It took a while. It takes education to go into that. Now, because I play myself, I perceive the complexity, how hard it is to achieve it. It makes me admire it even more. So organ players are probably the most sophisticated players of them all, because they have to work 4 limbs while they play. And they play like a polyphony of 4 sometimes all together, if not more. So this is amazing. I mean, their mind is probably, if they'll do an functional MRI on their brain while they're playing, it probably looks like a colorful concerts. It looks like like they have fireworks in their brain.
Yeah, it's a lot of stuff going on, and I'm not a top organ player, but my partner's brother is, like, toured all around Europe playing, and it's just like wow. When you see it going, but I love that. And so I know you said there's connections there, but how do you think the study of music and the arts informs the way that you practice medicine? I know that you use it when you're doing plastic surgery, but do you find any other parallels?
Many. So arts, training as an artist, first of all, teaches you about harmony and proportions and the importance of technique and strive to perfection. Mm-hmm. That's one aspect of being an artist. Mm-hmm. And never being happy with your results in the baseline is the way you get better results. And if you'll ask my staff, they'll tell you what is Dr. Wiser usual response to what he does. They say he's not satisfied, he's not happy, he wants more, he wants to get it better. And that's me. The second thing is the message. So art is about communication. It's a form of communication. And that translates to the communication between me and the patient.
Yeah.
So the surgery or the procedure is actually a vehicle to transfer feelings, emotions, and message and communication between. And I'm here as a messenger, someone who created as a gate to make the person more whole, more complete, more satisfied. And it's never a one and done. It's a process. I always say it to the patients. It's like, it's not buying a perfume in Sephora. Take it from the shelf. It's yours.
Exactly.
It's a process. Always. I'm going to perform the procedure, but then there's a healing time. You're going to be swollen. Things are changing. It's going to affect your life for a limited period of time. But I can assure you that after several months, it will most probably change your life for the best.
Yeah, definitely.
and you'll be happy with it. And the most important thing for me as a doctor, and I think that it differentiates me a little bit from other plastic surgeons, that I want to be part of the process. I'm there for the process. I give my patients my cell so they can text me, cry to me, complain, share, and we do it together. I absorb it.
Wow.
I'm compassionate and sharing their pain and the frustration of healing until they get to the safe harbor, to their desired results. Sometimes it's very fast. Sometimes it takes longer.
Wow.
But that's what I'm trying to do.
Wow. So that's a lot of energy that you're taking on, into yourself. And, with that, do you find that when you're taking on all this energy of your patients, when they're going through it, that what am I trying to say here? Like when you're taking on all the energy from your patients, like what are you doing to make sure that you stay even, if that makes any sense,
Right. Well, I have my mental boundaries. To and the way I interpret my patients concerns and energies that I transfer to myself and transfer back. And I think that most patients, from my experience, they're looking for someone to reassure them that it's going to be okay. They're looking for someone to address their concerns. They're looking for someone who listens, mostly. Because most of the intelligent patients understand that it's a process. It's going to take time. The swelling is going to go down. The scar is going to go down and fade. And they just need someone that can listen to them, hold their hand, and say it's going to be fine. So I always think about myself or my relatives, what kind of treatment they like to get. How would I like to be treated, addressed? What kind of service? I'm providing a service. What kind of service, what quality of service I would like to receive from my doctor? I mean, I'm a doctor, but I can also be a patient. So I am sometimes. So I want someone who treats me with respect, gives me all the information, honest, and there when I need it.
Yeah, I mean, I think that's what we want in life in many different places. And it's like, in a doctor's office, you don't always get that transparency. But, when you're dealing with something so intimate as how your body looks or what have you, I think that is a nice touch that you do add to your practice. And I do think it's a differentiator, because when I saw that you were putting your cell phone number out on the internet, so I was like, oh, wow, I was like, that's intense. But you do that and you're in your patients, obviously it pays dividends because they appreciate what you do for them. And so with that, juggling those energies of your patients and all that, I know you're a family man too. So as a plastic surgeon and as a researcher and everything that you do, what do you attribute to keeping yourself somewhat balanced? And do you even think balance exists, or is that just something that they talk about on LinkedIn?
Work-life balance, they say, right?
Yeah.
Well, my life is not balanced most of the time. I think in overall they are, but we always shift. I mean, I always shift. You allocate your energy and resources to a specific goal that you set for yourself. My anchor in life is my partner in life. It's my wife.
Yes. Amen.
And she is my life partner. mother to my children, my business partner, my life coacher, and we support each other.
So great.
And we set the goals together. We set the short-term goals. We should set the long-term goals, and we talk about everything. And we know each other very well. So we, even when we disagree, which happens often.
Of course, I disagree with mine this morning.
We already, both of us, we know the path. We know the path for resolution. So we walk by it. I think one of the key for a successful partnership is a good sense of humor, which we both have. So we enjoy it. Sometimes we can't even have a decent fight because we burst and laugh.
That's so great.
Yeah.
That's so great. And how long have you guys been married now?
We married in 2003, which makes us married for 18 years.
Oh, that is such a beautiful thing. I love that. But what you said is key there, so work-life balance, of course. Hey guys, it's fake. Okay, but it's just like what you said is key there about having a partner who understands what you're doing, and you set the short-term goals together and the long-term goals together. Because when you kind of set those, I'm going to call them contracts, quote in quotes, with your partner, they can't come back to you and complain and say, oh my God, you're working 18 hours a day or something. It's like, no, this is what we set. And it takes a special type of person to understand the drive that their partner has, or both of them has, to get what they need to get done.
Yeah. And speaking of contracts, my wife's a lawyer, so
yeah,
she remembers every word I say.
Oh God, so nothing's getting by her in that household.
Yeah, I'm doomed.
That's so wonderful. And so with that, the pressure from all different sides, but we're going to go over to, I know that okay, what I want to ask you is about pressure. So all these different things, you have pressure. So there's a quote that says pressure is a positive force when you're in command of the situation. I know that you're an avid runner and you do all these things, but as a person as active as you, what does that quote actually mean to someone like you?
So you can't be always in command of the situation, but you can definitely be in control of yourself. Yeah. And when things get rough or not going according to your plans, I found that taking a deep breath, counting to 10, and recalculating quietly with yourself what are you going to do is much better than being impulsive and doing a flick of the wrist kind of response to stuff. And the older I get, the more I act in the first way I mentioned. I think it's mostly about communicating with the people who are in charge of the situation, involved in the situation, and trying to resolve things, through communication and diplomacy. I see it a lot with my patients, my colleagues. We deal with conflicts every day. And it's always better to resolve them in a manner that people will feel that they're, again, being respected, communicated to, and issues resolved together with them rather than being put over their heads and that's how I want it and do it.
Yeah. So I like that advice though. You can't always be in control, but when something gets out of control, take a deep breath and think about what you're going to do instead of doing something impulsive, because those impulsive things are what gets us all into problems in many areas in our lives.
Absolutely. Absolutely.
Yeah.
Sometimes silence is golden, exactly for that reason.
Yes. I agree with that 100%. Speaking of silence, you're in silence a lot and you've written a lot. So when I was looking into your background, I see that you co-authored over 58 research papers. Like, I don't know where you get the time to do this stuff, but I know that draws on your PhD in epidemiology. And so a question that I wanted to ask you is, how do you integrate holistic health into the disease, in quotes, of aging? And how do you believe that diet and other factors affect the aging process?
Interesting question. So I will start by saying that being an epidemiologist have contributed a lot to my philosophy of medicine. Epidemiology sees things in a big scale. It's a kind of a philosophy of how do you look at things. And when you look at things on big scales, it looks very, very different than looking at on the one-on-one perspective. So it allows me to switch between the perspectives of seeing the patient concerned in front of me and seeing the population aspect of it. When it comes to being an aesthetic surgeon and a plastic surgeon, it helps me to understand where my patients are coming from, what other factors in their life affects their desire or goal to become an aesthetic, to go through an aesthetic procedure. And I'll give you an example. When I was a fellow, I had a patient coming from me for a breast reduction, a 24-year-old patient who wanted a breast reduction. When I examined her, and she told me her breasts are big and she feels that they're heavy and she wanted them reduced. I examined her. She was a B cup. Yes, very small. And then I continued to examine her, and I saw a lot of scars on her wrists, many scars from cut. So I naturally asked her, when was your last admission? And she said 3 months ago, and she's an anorexia nervosa patient, meaning that she had a mental. So you understand you're dealing with a body dysmorphic disorder.
Yes.
I am sure that some surgeons would disregard it and operate on her just for that reason. But in the greater scheme of things, you need to do the right thing and take the interests of your patients first. So I referred her back to her therapist. I told her, you don't need a breast reduction, you need therapy.
Wow.
And I try to look at things in a holistic manner. It's not easy because there are many factors going into aesthetics. Aesthetic service is something that is, again, it's something that you don't need. You want it, right? It's not a necessity. Sometimes it's not a commodity. It's a service. You can live until 120 happy without any aesthetic procedure whatsoever.
Of course.
So the health of the patient comes first. I am proud of doing the most extensive pre-op lab work and exams before I put a patient on my table, because I just want to make sure that the outcome is perfect. I don't even trust the patient about what he does. I do the lab work anyway.
Wow.
Yeah, I check for smoking, for drugs, everything.
Wow.
And I'll tell you why, because no one will care whatever excuses I have after a bad result.
True.
And if I put my knife on the patient and I wouldn't make sure his body is optimal and ready for surgery and the patient is ready for surgery. Because a bad result is a bad result. And then go explain, but he lied to me. He didn't. No one cares.
No one cares.
There you go.
Wow.
So you sometimes need to save the patient from himself.
Yeah, and that point where even with that patient you talked about that you said you don't need plastic surgery, you need therapy. And if all, doctors could really do that, but some people are just so concerned about the dollar signs. They're like, I'm going to get this money, and they don't care that the person's going to maybe then, do something harmful to themselves after they get that procedure. Like
we all want to get a decent, honest living, but it's not worth it to damage someone just for that. It's just not worth it.
Exactly. And so, speaking of things not being worth it, I know that there has been a lot of contention for some doctors in the industry, and some have thought that nurse practitioners or nurses shouldn't be doing non-invasive aesthetic procedures. And I just want your opinion. What are your thoughts on that in the field now? Because it's skyrocketing.
Of course.
Yeah.
Well, I think that there are many talented nurse practitioners, physician assistants that inject and do facial rejuvenation with Botox and or neuromodulators and dermal fillers. They can do it very well. And the only thing that I think is important is in their training to educate them and make sure that they understand the limitations of what fillers and neuromodulators can give to improve the appearance. It can't solve everything.
Yeah.
And nurse practitioners should know how to convey it to the patient and be honest when they understand that fillers won't help them and Botox won't help them. You were speaking about the dollar sign early on. So that is the most important part of the NPs and PAs training when they want to become injectors. It's not what they can do, it's what they cannot do.
Interesting.
Exactly. So they know how to hold a hammer in their hand, and then every aesthetic problem in the face becomes a nail. You don't want that.
No.
And they should know when to refer to another provider that can have better solutions. Us as plastic surgeons, we have a bigger toolbox.
Yeah.
And a wider array of solutions to aesthetic problems. We are more experienced in doing that. We're more experienced in seeing complications because we treat them, and we know what will help what, because we are pretty confident in offering other solutions when we think that what the patient wants. Sometimes the patient just come and say, "I want a filler," and said, okay, why? What concerns you? What's the problem? No, someone told me. And then you do your assessment. You give them your professional advice. You educate the patient about them. And then the patient is more aware, and he can make more conscious, better decisions for himself. And I think that's the main thing. So I'm not against nurse practitioners and physician assistants injecting. I'm for it, but I am for also having them properly educated about the limitations of this treatment.
Interesting. And that makes sense. I mean, so cultivating, we talk about relationships and things. It's like, so cultivating those symbiotic relationships with, plastic surgeons, that could only, I believe, help a practitioner, because not only having a relationship that you can refer out to if needed, but your clients, when you have that good bedside manner and you're telling them like, I want to help you, however, I'm not the person to do it, they're going to respect a provider more for giving them that spot on advice, and then they'll be able to work with the plastic surgeon to get the result that they do seek.
Absolutely.
Yeah, so I think that's excellent. And I know we're wrapping down here, but this is the question I really wanted to ask you. And so my question to you is, what is beauty to you? And how do you believe the Kardashianizing of the female body is affecting how us women see ourselves? And my other question to you is, how do you see that being reflected in what your patients are asking for? That's a loaded question, might be too much.
So I differentiate. I think it's a fantastic question, and I love the Kardashianizing. I love it. So my definition of beauty is something that is universal, harmonic, and can be described even in mathematical terms. It's, this universal proportion that we talk about all the time. We can describe it in every living thing. And people usually are fantastic judges of beauty. They can score beauty in universally. It's like going through everybody's mind and define it pretty good. And that's actually described by many studies that are being done.
Oh, yes.
And people can be described and, scored by universal beauty scoring, and everybody can be a beauty contest judge and give great result. We don't need celebrities for that.
Yes.
But there's another term that I think most of my patients, when they come to me, they are looking more for this definition, which is attractiveness. And attractiveness is a more complex, more personal, more subjective term that encompass both beauty and also, everything that we pile up on it. And it's something that also is radiate through us and people see and perceive. And it has many, many things that, a person that looks at someone conceive, is it attractive or not?
Oh, yeah.
And it goes to many things. And when I treat my patients and I'm doing an aesthetic procedure, my goal is to make them feel more attractive.
Okay.
That is the goal, because and one of the things that creates a better attractiveness of a person is his sense of confidence in how he looks. And if someone is going through a breast operation and she feels that she's more beautiful and she feels more attractive, people will think she is more attractive because it changes her behavior.
Interesting.
Right? For breast reduction patients with big breasts, they usually go like this, they're crooked forward. They try to hide their breast because they're a little bit of ashamed of it or embarrassed. Once they go through the operation of a breast reduction, they straighten up and they go with their head high and they feel more attractive.
Wow.
And people see it. The level of confidence changes. It affects them, and that's the little trick. Now, on the other hand, we are witnessing a big shift in human society, because now our minds live on Instagram, on the corner of Facebook. We are living in the virtual reality realm, in social media realm, and we see ourselves all the time. And we communicate like this to other people. And suddenly the way we look, which was always very important. I think there's also a difference between men and women in that sense.
Yeah, that's another podcast altogether.
It becomes even more prominent, more dominant. And now, because we are exposed to more aesthetic solutions, we want to see ourselves better. We want to be more attractive in the social media. And that makes us more busy, all the aesthetic providers. We also have more time. We also have more funds. All this streams it into the aesthetic providers, products, and everything. Now, I think in general, it's a positive thing. But I think that if I'm trying to educate my patients, is about, moderation and proportion. Don't be radical. Think it through. Yes, you want to feel better about yourself. Yes, we can take care of things that bother you and make you feel and look better. But you need to take everything under consideration, and you need to understand the process, the risks sometimes, alternatives. So you need to think it through. I can help you think it through. I can help you reach a decision. But be conscious about it and give it attention. And if you'll do it like this, you'll enjoy your results much better for a longer time.
That makes a lot of sense.
That's what I think it's all about. And don't jump to conclusion.
Exactly. Just because Kim Kardashian did it, guys, doesn't mean that we have to. Exactly. I love that, how you kind of integrate, the mathematics side of beauty and integrate that with, the kind of more is intangible, the attractiveness, and how those things kind of combined overall can make your patients feel better. And I think that's one of the best messages there in that answer. And, my last question to you is, as a business owner, if we're talking to the people who are listening, because a lot of people are listening are, entrepreneurs in the aesthetic space, or they want to be, what would be one piece of advice that you would give to those who want to start the old medical aesthetics business, whether they're going to be on the, non-invasive side or the surgery side?
Well, my advice is coming from a mouth of a young entrepreneur. My business is young.
Yeah. So
take this under consideration when you use my advice. I think that my biggest advice to everyone who wants to start an aesthetic business is to embed your identity into the business, make it your own, and let your personality shine through it, because that's what's going to bring the most authenticity to what you do. Because in this type of business, people are giving their body to someone to make it better. That needs a lot of trust. People are very concerned, very intimidated by doing it. And I hear from all my patients, if you put your identity forward, if you put yourself forward, if you are honest, and if you're humble with your patients, you will gain their trust. And humble and honest with yourself as well.
Yeah.
I chose this, and I choose it every time over, promising things that I'm not, maybe I can't, deliver, or creating a hoo-ha until just to get the volume up. I prefer to have less patience, give them more time, and be honest with them. Don't promise, the moon, because I just can't deliver. And enjoy this relationship with the patients, because you get a lot of satisfaction from it.
That's beautiful, and I just have to harp on that last point again. It's better to have less clients who appreciate what you're doing, and you get to invest more time with them. It's better than having 30 people come through your door a day, and it's a very transactional process. So I think, anyone, any field, I'm in finance, you're in surgery, other clients it's like less is more. And you said that earlier, I think.
Less
is more.
It's not the retail business. We're not selling, perfume.
Exactly. I love it. Oh my God. So tell our listeners where they can find you on social media, and I'm going to link everything in the show notes, but where can they find you on social media and your website and where you're located?
So I'm located in Midtown, in 5th Avenue and 44th Street. You're all welcome. I have an Instagram page. It's Dr. Itay Wiser. And I have a website that you're all welcome to go in. There's a lot of educational material over there, which is wisermd.com. And please contact me for more information. Come for a consultation.
Yes.
My practice is located over one of the high-rise buildings over there on the rooftop. So there's like a fantastic view of New York City.
Nice.
And I operate there as well. I think I have the most beautiful OR in the United States, but that's my personal opinion. The view is just amazing. Sometimes I'm concerned that I'm going to be too concentrated on the view and it's going to distract me from the procedure. I'm just kidding. It's that beautiful.
That's awesome, though. And any of you guys who've been to Manhattan know if you get a good view, you have a good view. Oh my goodness. Dr. Itay Wiser, thank you. Thank you so much for allocating some of your energy to this podcast and to spend some time with me today. I appreciate your time.
I enjoyed it.
All right, thanks.